Welcome to NSC 111 Foundation of Nursing class. I remain your facilitator, Dr. Elizabeth Joseph Shehu, and today we'll be looking at physical examination, which is also known as physical assessment. It is a systematic examination of the body structure. And what do we want to achieve at the end of this class? At the end of this class, you should be able to describe the appropriate use and techniques of inspection, palpation, percussion, and auscultation, which are the four approaches or four techniques in physical examination or physical assessment. There are, like we said, we have four basic of them, which is inspection, percussion, palpation, auscultation. And the way it appears in that order that you use it when the four techniques are required in an individual. Conducting physical examination may be done using the cephalocaudal, that is head to toes approach, or the body system approach. So when you want to use a cephalocaudal approach, which is head to toe, you start from the head and down to the toes. And what you first of all do, you inspect. And when there is any aspect of the body that need percussion, you percuss. There is any aspect that need palpation, you palpate, and lastly you do auscultation. However, in all situations you do inspection, but not all situations that require percussion, palpation, or auscultation. Let's go on to the class proper. Take it one after the other. The first one is inspection, and the way we explain that, if you are performing the four physical examination on an individual, that is the sequence you do it. That you first of all do inspection, percussion, then palpation, lastly auscultation, except in certain situation that you will not follow that order, which is abdominal palpation in pregnancy. So first of all, we start with inspection. Inspection, this is the most frequently used assessment techniques. So for everything that you are going to do in nursing practice, you have to inspect your patient. You have to inspect that situation before you know what to do. And that is why I said that it is the most frequently used assessment techniques. And it also involves deliberate observation. It involves deliberate, purposeful, and systematic observation to identify deviation from normal. Like this, look at the individual, that you have to be deliberate. Focus on what you want to do. There must be a purpose of what you are observing, and it must be done in systematic way so that you can identify when there is any deviation from normalcy. Percussion is the least technique that usually used by nurses. It required considerable skills, and it's not in all situations you use it. When you talk about percussion, it involves striking or tapping a particular part of the body to produce vibratory sounds. The quality of sound aids in determining the location, size, and density of underlying structure. If the sound is different from that which is normally expected, it suggests that there may be some pathologic changes in the area being examined. Percussion can be direct, indirect, and blunt percussion. We'll take them one after. The first one is indirect percussion, which is the most commonly used. It produces clear, crisp sound when performed correctly. How do you perform it? How do you perform indirect percussion? To perform indirect percussion, you use the middle finger of your non-dominant hand. When you say non-dominant hand, it depends on the hand you are using. For people that are using right hand, that are right-handed individual, their dominant hand become right hand, while the non-dominant hand become the left hand. So to perform indirect percussion now, you place the middle finger of your non-dominant hand as the pleximeter. That is the one you are going to tap at the pleximeter by placing it firm on the part that you want to examine, on the part you want to percuss. Then the back of the middle pharynx is then strong. This back here, the back of that middle pharynx you place on the area you want to examine is strike with top of middle finger, this top of middle finger of your dominant hand, which is now become your flexor. This is flexor. You head it perpendicular to the pleximeter. This is what they mean by pleximeter. The one you place on the examining structure is known as pleximeter. Then you tap lightly and quickly. Then after you tap with this top finger, you remove the flexor as soon as you have delivered each blow. And remember, what you are you are not using, you are to deliver the stroke from the wrist and finger joint, and not from the elbow. So whatever strike you are going to try, you are going to use your wrist and your finger joint. The second type of percussion is direct percussion. The nurse strikes the area to be percussed directly with the pad of 2 or 3 or 4 fingers, or with the pad of the middle finger. The most important is that you have to press with the pad of the finger, depending on the finger you want to, your number of finger you want to use. And this method helps in assessing an adult sinus. Remember, sinus, this is sinus that this nurse is assessing here. You assess the sinus for tenderness. The third one is blunt percussion. This is done by striking the ulnar surface of your fist against the body surface. So how do you do it? Alternative, both arms may be used with the palm of one hand placed over the area to be percussed, and then strike it back with the fist of the other back. You make a fist. When you make a fist, you can make a fist directly and hit that area you want to percuss, or that is when you are using one hand. Another one is that you place one of the hand on the surface and you make a fist and hit. Both techniques aim at eliciting tenderness, not to create a sound over such organ as the kidney or gallbladder or liver. So it's to, when you are percussing organ structure that is deep inside the body, you use blunt percussion. And in this case, you don't want, it's not only the sound it created you want to listen to. This time around, you want to know if there is tenderness. The next type of examination technique is palpation. Palpation is an assessment technique that use sense of feeling and pressure to assess structure, size, placement, texture, temperature, density, mobility, pulsation, and tenderness. In you taking pulse, you make use of palpation. We have two types of palpation. We have the light palpation and the deep palpation. Light palpation involves the use of pad of fingertip, the dorsum of the hand, or the palm. These parts are used because their concentration of nerve ending make them highly sensitive to tactile discrimination. In light palpation, the body surface is indented gently using the slightest touch possible, as we have it in pulse taking, that is taking pulse, or you use the dorsum, that is the back of the hand, when you are checking body temperature. Too much pressure blunt your sensitivity. When you apply too much pressure, you are not going to feel anything as such. The nurse extend to dominant hand fingers parallel to the surface, to the skin surface, and press gently while moving the hand in a circular form, that is in a circle, like we have in pulse, or depending on whatever palpation you want to do. Deep palpation is done with two hands, by manually or with one hand. In deep palpation, you can use both hands actually. It depends on the surface you want to palpate. The hand is held flat and released and molded to the body surface as in light palpation. The best movement is gentle but with firm pressure, with the finger held almost straight but slightly flexed at the metacarpopharyngeal joint. Indent the skin or tissue about 1 to 1.5 inches. Place your other hands on top of the palpating hand to control and guide your movement. This approach is usually employed when palpating for deep underlying hard to palpate organ such as liver, kidney, spleen, or to fix or stabilize an organ such as uterus while palpating with the other hand. Variation of deep palpation are of 3 types. We have rebound tenderness, as when you want to examine a patient with appendicitis. Press firmly with one hand and then lift your hand away quickly. Rebound tenderness is present if the patient complains of increased pains as you release the pressure. Then the second one is light ballotment, usually performed by applying light rapid pressure from quadrant to quadrant of the patient abdomen. Hands are kept on the skin surface to detect tissue rebound. We say that quadrant by quadrant, we have about 9 quadrants in the abdominal region. You have the right hypochondrial. You remember by the time you in your second semester you'll be doing these quadrants. I also know that in your nursing school you have been taught we have the upper quadrant, lower middle quadrant, and the lower quadrant. In each of the quadrant we have three aspects. For instance, in the upper quadrant we have the right hypochondrial epigastric region and the left hypochondrial. Then while on the middle quadrant of the abdomen we have the right lumbar, umbilicus, and the left lumbar. Then on the lower quadrant we have the right iliac, hypogastrum or suprapubic region, and the left iliac. So when you are doing light ballotment, you apply light rapid pressure from quadrant to quadrant of the patient abdomen. Hands are kept on the skin surface to detect tissue rebound. Then deep ballotment, this is performed by applying abrupt deep pressure and releasing it while maintaining contact. Palpation forms the most important of abdominal examination. And when you are performing palpation, you need to ask your patient to relax as much as possible and breathe quietly. This will make the area you are palpating to be relaxed, and be able to get information that will help in your diagnosis or in your care that you give to the patient. Light palpation, deep palpation. You see, in light palpation you will not press deep into the structure, while in deep palpation, like we have explained in the previous slide, you apply deep pressure. Now, rebound tenderness, you place your hand, see the way this hand is being placed, and you apply pressure and deep pressure, and you release your hand as quickly as you can. The next one is auscultation. Auscultation is an assessment technique that involves listening to sound created in body organ to detect variation from normal, and is mainly used to examine the chest, abdomen, or any other structure within the body that have sound that can be observed sound from. Some sound can be heard with unassisted ear. Most sound are heard through a stethoscope. You must first become familiar with normal sound before you can be able to pick abnormal sound. The heart, lungs, and abdomen are the structures that are mostly often assessed by these techniques. Assessment of different types of sound. Assessing high-pitched sound. Example of high-pitched sound are first and second heart sound, that is S1 and S2, and breath sound. This is done with the use of diaphragm of the stethoscope. I'm sure we remember the part of the stethoscope. I think most of these parts we will be learning it when we are doing physical examination. as that is, we have a course in that is NSC 209 that called physical examination. So you learn more on this when you are taking that class. And when you are doing when you are assessing high pitch sound, you ensure that the diaphragm entirely cover the surface you are using, firmly apply to the patient's skin. Assessing low pitch sound, the heart murmur, which is third and fourth heart sound, known as S3 and S4, are all low pitch sound. To pick such sound, lightly place the bell of the stethoscope on the appropriate area. Do not exert pressure. If you do, the patient chest will act as diaphragm and you will miss low pitch sound. In conclusion, as nurses, remember that history taking and physical examination remain essential skills for you. That's why we have nurses aid nowadays that do some of our activities to ease the work for us. But come to these two aspects is purely nurses' responsibility. Height assessment is a vital part of nursing care because you cannot do anything in nursing without health assessment. And when you are conducting health assessment, it's done in a systematic manner and start with history taking and physical examination. For you to perform each of these as a responsibility, you must be effective in your nursing, you must be a good communicator, and you must have a good interpersonal skills. While skills in inspection, palpation, percussion, and auscultation are needed for complete physical examination. Remember to go to your student portal and take your TMA1. It has opened. As much as possible, listen to the previous session we have had, and also make sure you do your reading assignment before our class. Complete the reading assignment before our class. With this, we have come to the end of today's class.